My name's Kate Adams, I'm a GP in London. And I think because the forum was going to be in London this year, we were very keen to sort of showcase primary care and all the changes that we've had. And, you know, often people look to the UK and we have this kind of comprehensive primary healthcare system and people are very interested in it. So we set up a day, we had 40 international guests who came along to the day. And what we did during the day is we took people to Bromley by Bow Centre, which is in Tower Hamlets, where they met Dr. Sam Everington, who's also the CCG chair of Tower Hamlets. We also went down to Woolwich and met a public health consultant who was talking about improving population health through primary care. We went to London Deanery, which trains more GPs than anywhere in the world, to talk about some of their training initiatives. And at the end of the day, we came to my surgery in Hackney, where we had a big photo exhibition of our patients talking about their lives and what's important to them. So I'm going to introduce, we've got two international visitors who came along on the day. Florian, can you introduce yourself?
My name is Florian Suter. I'm a general practitioner since 23 years in the northwestern part of Switzerland. I started with a single practice, but now we are a group practice, and since 7 years I could co-found a medical network. We are now nearly 50 doctors working together and doing together quite a good job and improving the quality.
Andrew.
So I'm Andrew Old. I'm a public health physician in Auckland, New Zealand. I work for Auckland District Health Board and have two roles there. One is working in our equivalent of our commissioning team, providing advice around service integration, improving population health through primary care, and quality improvement. And the other part of my role is as clinical lead for a quality improvement team in our major tertiary hospital, so foot in both camps.
And Rob, who organised the day with me?
I'm Robert Varnam. I'm a GP in inner city Manchester in the UK, and I'm an advisor and trainer in quality improvement and service design and system improvement, working at NHS Improving Quality.
Okay. Should we kick off with Hilary Geet and the public health consultant down in Woolwich and what people's reflections were on that visit and what people felt? I was very interested in, I think she said that they'd done 5,000 health checks and they were trying to very much capture people that general practice missed. So improving population health through that. What were people's reflections, ideas and thoughts about that visit?
And look, I found that particularly interesting. In New Zealand at the moment we have a national health target around CVD risk assessments, and primary care is expected to have screened 75% of their eligible population by the middle of this year and 90% by the middle of next year. And one of the challenges that we're grappling with is how to reach the people who don't traditionally present, and experience from one of our local GPs who's here at the conference actually, we're saying they've tried the usual, send out the letters, but a lot of the people that try in the eligible group to screen are not people who usually present to general practice. So some of that I thought was particularly helpful. And the other thing I thought was interesting was, of course, the getting people in to do the check is only part of it. Of course, the thing that makes the difference is then following up with the management of whatever risk comes up.
So what were they doing in Woolwich that you thought you might be able to take back to New Zealand?
I'll have to think about that for a minute.
Okay, all right. Rob, do you want to comment on that?
Something I found very encouraging actually was seeing an approach to public health which was making the most of what we have already. I'm always slightly upset where we say we've got a public health priority and we have to add new things on, when actually in what they did there was to say what can we do to make the best use of the existing infrastructure, the teams we've got in general practice. And I think it was really exciting to see that Hilary was saying that so far they've got a target to get between 50 and 60,000 checks done, and just a year and a half in, I think she was saying that they've done half of those checks, and they've done it through general practice, but they've also done it through helping general practice just slightly look up from our our own desk. And I thought that was really, really interesting. And I was really struck by her saying that general practice is part of improving population health. We care about it. We're really located and grounded in our community, but we never see the data. So she was saying that, you know, you come to GPs and you talk about, you know, life expectancy around here is 10 years below the average of what it could be, and people are living unhealthy lives and shorter lives, and we could do something. And in general practice, it doesn't feel like that, because we see people one person at a time. But as soon as you show practices that data, actually practices were saying, well, how could we be part of helping that? And as soon as you help people to kind of raise their gaze a little bit, some of the stuff that really excited me was how easy it was for a practice to run some screening outreach activities in their local community, sitting outside a supermarket. And that as soon as they started doing that, they started getting hold of some of the people who normally don't turn up. And she was talking about middle-aged men with big waistlines, and the fact that, you know, they're the most necessary to be screened and the hardest to get into a GP surgery. And that after a few days of running this, local women were going and getting their men folk to come shopping with them and dragging them very quickly in for a quick health screen. And they have picked up people with frank diabetes and terrifying blood pressure. And they, you know, that's how you save lives.
She also mentioned that the men enjoyed being picked up, which I was interested in. She said they actually quite liked the experience, and it was a way of engaging a difficult group, as you said.
I think the other thing about, sorry, I was going to say the other thing about you mentioned using the population data. I think it's looking at the variation between practices and the power that had. And again, that's something that we're starting to try and do in New Zealand. But I thought that particularly, the way they've done it particularly well was not just to show all the practices where they were, but to be really clear about showing practices, other practices like them, so they could compare their performance against practices with similar registered populations, and the power of that.
Florian.
For me, it was very important to hear that, because usually I have, let's say, some difficulties with the health check. Until now I thought, well, I don't know what is it worth, but you know, in Switzerland we have nearly no registered patients. So I have a practice, but I don't know really how many patients I have and which patient is mine. I mean, it's not mine, but which patient would come to see me. I could co-found 6 years ago, or nearly 7 years ago, a medical network, and we have special contracts with the insurance companies. So in this model we have registered patients, and I see with the discussions and what I heard in Woolwich Arsenal, or was it in Greenwich? Or?
Yes, Woolwich Town Hall.
Woolwich Town Hall, I'm sorry. What I heard shows me how important it would be that all the patients would be registered and had their general practitioner or their general practice to come and to be contacted, and we should tell our patients, listen, I didn't see you for 4 years, please come, and I have to discuss something with you, and I have to measure your blood pressure, and I have to perhaps to see how's your cholesterol, how's your blood sugar, or something like that. I don't know how it's done in Switzerland. I fear it's not done at all, and we are struggling a little bit.
Okay. I'm going to move on to talk about Bromley by Bow Centre, because it's a rather special place in Tower Hamlets.
Yeah.
What were people's thoughts? What did they take home? What were the take-home messages there, or things that they liked?
Well,
no.
it was certainly unlike any health centre I've ever been to, and I think you know, it just felt grounded in the local community. And I think from talking to Sam Everington and seeing the mix of patients, and we met a potter, and we saw an adult learning class, and just that sort of sense of general practice really being part of the community, and how that connection with the local community can really help to improve health. I thought was something that we is really able to be built on. I thought it was interesting that he did say it's been there for 25 years, and so the sort of I guess the message I took from that is it's not, you don't just go and build one of these things. They do take time to develop, and they need to be, if they're going to be connected to the community, then obviously the community has to have a real sense of ownership in the way that they're built up and established.
They'd managed to build it in a park, which was extraordinary.
3 acres.
3 acres of a public park that they'd leased. They were involved in managing the park as well. Rob, what were your thoughts?
I was hugely inspired. I think to see the values, the ideas that we've talked about for years actually put into practice. To see some of the founding promises of general practice. We're in the community. We're not just about treating you when you fall ill. We're about helping you to stay well. Health is broader than medicine. They're principles on which we've built in the UK, we've built our whole health system on in some regards. They're principles which the world looks to the UK and admires often our approach to primary care. But it's not often you see it put into practice to that kind of extent. To see a GP practice who, as you were saying, Andrew, who use creativity as a means to improve people's health and well-being, who are open to new ideas, who put the ideas into practice instead of just dreaming about it. I found really encouraging, because I think often we get so caught up in the rat run of daily life and crunching through being busy that we forget sometimes that some of the principles we talk about aren't just a dream. If you put them into practice, they work. So you hear about the fact that in the most deprived area of London, they've got the best screening uptake and they've got the best blood pressure control. And they don't do it because they've got access to some different drugs from the rest of us. They do it because they put their money where their mouth is, and they say, health is broader than medicine. We can engage with people as partners in the local community. And lo and behold, people get better quicker. They're leading happier lives. They're using hospital less often. They're more independent.
They also had use of good data, didn't they? I mean,
Yeah.
Sam described very well the use of their data, and they put it to good use, bringing practices together to compare. So stronger practices alongside practices performing not so well with diabetes care. But they all had a vested interest, and a financial vested interest, in improving it for everybody.
Yeah, and I think that was key for me as well, that we sometimes set up a bit of a false dichotomy, I think, between the choice that we either really care about our patients as people and we're engaged in their life and in the narrative of their life and their creativity, or we do number crunching and we aim for targets and set ourselves goals and hold ourselves accountable to getting there. And I think that was a really lovely example that they are not mutually exclusive, that if we care about the narrative of our patients' lives as people, we know that actually the following 7 things need to be done for someone with high blood pressure, and if you do them and hold yourself to account for it, they will lead happier, healthier lives. And so the marrying of the data, the really hard-edged quality improvement stuff, comparing, reducing variation, with the understanding that these are people, we need to treat them as partners, get into the story of their lives, both together, they work. I thought it was lovely.
Florian?
Well, for me, the visit at Bromley was something like the reality of a vision. You know, I think since I started my medical studies, I knew I would become a general practitioner, and I wanted to be rather in a rural country and not in the middle of a town, and I could do that really, and I realized that I had a vision. And I came to Bromley at Bow.
Yes.
Yeah, and I just found that. I just found that, and I would so much like to take some points of there and to see if I could go to Switzerland and see how to manage that there. I was also very impressed that the man, I don't remember his name, he said, don't make a copy of us, but let you inspire and go back where you work and see what you can do. And that was so fantastic, and everything you said. I mean, when I'm a GP, it's so fantastic to be a part of the life of our patients and their narratives, and that's what I felt so concretely in that health center, and as you said already, it's not only the blood pressure, but it's only their lives, and it's the interest for how are they living, and how can they have a better life. And well, perhaps it's very interesting that it started with a church which didn't know what to do. They had a church. If I understood it well, they had a church, and they went to the community and said, well, what could we do? And it started there, and it's absolutely fantastic, really.
Okay. We also were at London Deanery, and Nav Channa there set up a number of speakers, and we had some discussions. What were the main points that came out for people about that time we spent at the London Deanery, which I understand is the biggest training school of GPs in the world? They train 1,300, or is it 1,300 GPs? So the biggest GP training school in the world. Andrew?
And I think one of the things that I found particularly interesting about that, and connected to the time we spent out at Woolwich, was I guess the training reflection on getting population health into primary care. So we sort of at Woolwich we saw, well, this is some of the things that are happening, but then at a training end saying, well, actually, how do you get people involved? And the thing that I found really heartening about that was talking to the presenter, whose name I forget now, afterwards. He said that they had lots of people when they put the call out and said, who wants to do this as an optional 4th year of training, and focus around sort of population health. They had more people than they could take to take that up, and that they did some really good work. And I think that if they can extend that model, because we're talking about in general practice, very difficult to lift your gaze and think about the big picture and demand access to the data if you aren't in a position to generate it yourself. Getting that into training, through undergraduate, but also particularly that sort of postgraduate vocational training, I think will be really beneficial to the crop of GPs sort of 5-10 years down the track.
Rob?
I think for me, all of the presentations, it was great having such a variety and seeing how much is being done to support the next generation of doctors and leaders to kind of have the skills they need. For me, one of the themes running through all of it was some of the things that our patients and our communities need us to do don't just happen. You have to train people for it. You have to skill people up for it. And it's great to have a vision. It's great to have the models and the examples that we could sort of seek to emulate or learn from. But most of the time, you also need to invest some time in some skills to make that a reality. And I think all of the speakers who kind of talked about what they've been doing demonstrated how actually relatively straightforward it is to do that. People in primary care who want to learn, want to engage in their population, a bit of skills investment, you can do it. People who want to take a lead in shaping the local health and care landscape, you can train people for leadership. You can support people to become more effective leaders.
But you have to do it.
But you have to do it. and you've got to have that, I think that joining up for me between the strategy and the actual training program. So we've got a strategy whereby patients are going to move more out of hospital and more into the community. You've got to train people for that. You've got to move the training with the patient.
I was interested by the nursing, that they'd had secondary care nurses coming to them to say, I want to have training. They weren't paying these nurses to be trained. They were offering training to skill them up to actually be able to deliver care in primary care where they're needed, as care, as Rob says, moves out of secondary care into primary care. Florian,
for me, it was very impressive to see what the UK is doing for its general practitioners, or for the trainees in general practice, because we in Switzerland, about I think 50% of the GPs are between 55 and 65, as I am. So in the next 10 years, there will be a huge gap GPs missing, and I don't really know what Switzerland is doing against that. I mean, yes, they are doing something, but I don't really know how it's going on. But I was talking to the head of the School of General Practice, and he said yes, he knew that. He was at a Wonka Congress in Switzerland and talked to and he said, well, perhaps general practice is he said sometimes less sexy than other medicine, but we all know that general practice in reality is a absolute fantastic work. And it's as you said, we have to give them the possibilities to the young doctors to know how it's like to be a general practitioner, and to teach them how to be a general practitioner. And we have more and more young doctors in the curriculum to get a general practitioner, and they don't want to be in hospitals, but they come to our practices. So I will this year, a young doctor, a female doctor, she starts to be for 15 months in my practice, and just next month a young doctor will also start to work 3 days a week in my practice. So, and I'm sure I can teach them something, but I'm not I'm not the teacher. I mean, I'm a bit the teacher, but I'm not from the university. So it's going a little bit informal, but perhaps it will become better and better. And I think students and young doctors more and more see that it's not the only way to be a good doctor, to be a specialist, or to be a hospital doctor. So I'm not so pessimistic.
And I think it is important to train GPs
Yes.
as well in a wide and variety way, because of what they're having to manage. Increasingly in the UK, there's the commissioning, there's the delivering primary care, there's the thinking about the population health that goes with that. So, and the management skills of running a practice and all those other things. And you know, and we are the last, well, one of the few generalists left in medicine other than geriatricians. You know, 90% of care is delivered in primary care in the UK.
We have, especially in Basel in Switzerland, but now it's all spreading out to other universities, the possibility that during the medical studies in the 4th year, the students during the semester go once a week, half a day, to a practice. So I have every year I have a student coming to my practice for just 1 whole year, and this gives a very good relationship between the trainee and me, and I think I can also tell them and show them how rich general practice may be. But I haven't to say that to you.
I was really struck from a lot of the talks, and a lot of the sort of one of the themes of the day for me was about the need to be really intentional about keeping interconnectedness going. That we often start our careers seeing the whole picture and seeing the way in which things fit together, and then partly our training sort of forces us down a more narrow tube, and builds walls between, you know, there's paediatrics and there's primary care, and they're not the same, and there's a big wall there, and there's nurses and there's doctors, and they're not the same, and therapists are in another box over here. And I think one of the things that was really inspiring about the approach the London Deanery are taking to training is acknowledging the interdependence of people. You can't be a great paediatrician if you're not connected with the community, with nurses, with general practice, and the same from all those other angles back into the centre. And I think, for me, some of the things that have been done in Greenwich and in Bromley by Bow and Tower Hamlets are showing that it is possible, even for established services and old dogs, to teach us to just look up and maintain some of the connectedness that our patients need. Because particularly as the number of people living with long-term conditions grows around developed nations. This idea that we pigeonhole people into a cardiology box or into a respiratory box, it's just wrong, and it's bad care, it's bad economics, it's bad experience, it's unsafe, and I think we need all of us to commit to maintaining that intentional interconnectedness that I think comes naturally. It's just I think we're trained out of it a bit, and life forces us down into our own little furrow. But taking time at a conference like this to actually connect with other people and recognise the power that comes from that is really important.
I wanted to end with asking people what was the highlight of their day. Florian.
Well, the highlight of this day was when I remember we heard from you that the NHS changed for 1st of April, and it was no April joke. Had a big change, bigger than every other change, at least since 1948. And I realized that the NHS is completely different to the system we have in Switzerland and another system in New Zealand. But for me, the highlight was to see when we went to Bromley by Bow that it doesn't count which system it is. What counts is the engagement of the people working there and doing and having the vision to do a really good job, and this counts. And I was so moved to see in the photo exhibition you mentioned. This was also to see in these fantastic photographies of your patients. So I think the highlight is whether you are in this system or in the other one, what counts is your engagement, and that's fantastic.
Andrew.
So I think, like Florian, my highlight really was the photography exhibition at your surgery at Shoreditch, and I think we talked earlier about the not focusing on just data or just patient stories, but actually bringing those things together. And I think the way that those photos were displayed and the way that they really took you from a clinical environment in a surgery into people's homes with their sort of, this is who I am, this is my story. I just found that really quite inspiring and grounding, and that really reminding us all about what is it that we do, and particularly for me in population health, which is sort of a step further removed. But at the end of the day, societies are made up of individuals, and so that sort of that real humanity that was displayed through those photos was really really special.
I think the highlight of the day for me was seeing, actually in all the places we visited, some of the purpose we have put into practice to an extent that I think most of us don't experience on a daily basis. To see the principle reflected that we're guests in our patients' lives, not the other way around. And to see that some of the founding principles of great primary care, that we are population facing, we're community connected, we know that health is broader than medicine, and that it's possible to work like that. Because I think those are principles that I believe in. They're why I went into general practice. That's why I'm proud to be a GP. But it's hard sometimes to step out of the medical model. It's hard sometimes to get out of thinking, I've just got to crack through the day and survive to the end of another day and get home before 9 p.m. Actually, no, the purpose is to help people to lead happier, healthier lives. And the highlight of the whole day for me was being reconnected with my purpose and our collective purpose in doing that for the people that we have the privilege of serving. And then of seeing that it's not just a pipe dream, it can happen. We just have to be intentional about it.
Well, thank you very much.
And thank you.
Thank you.
It was fantastic.